All right, we're live. Hey, hello everybody. It's Dr. Alex Earl here. We're at Pure Plastic Surgery and it's Hump Day with Dr. Alex Earl. This is the time I get to spend with you guys. We go over plastic surgery topics and of course I'm happy to answer all of your questions, okay? So today I'm gonna just delve right into it because we have a little bit of a long topic because today I want to give you the comprehensive overview of liposuction, okay? Pretty much all you need to know about liposuction, or at least almost all. I think I'm gonna try to get you at least 90% there, okay? So we're gonna talk about all the way from pre-op to post-op and recovery, and of course, we always have to talk about the potential for complications as well, okay? So that you guys are informed, so you're educated, and you know what to expect, okay? All right, so let's get right into it. So, comprehensive view of liposuction. So you're interested in liposuction, all right? And the first thing I'm gonna say before I get into all this is a very common misconception. Liposuction is not a fat loss procedure, okay? It is not a fat loss procedure. It is a body contouring procedure, okay? It is a procedure to change the shape of the body. It is not a procedure to lose weight, all right? We often get the question, you know, how much weight am I gonna lose after the liposuction? How many pounds are gonna come off? That's not the way to think of this, okay? So you actually have to be at your ideal weight, or you should be at your ideal weight before you undergo liposuction, the liposuction, okay? If you're someone that's overweight and your BMI is higher than, you know, much higher than say 30 or higher than 35 or higher, and you want to lose weight, then you should get into a weight loss procedure, which is called bariatric surgery, right? This is your gastric sleeve, your gastric bypass, and things of that nature, of course, or you can do it with diet and exercise, okay? But say you are, you know, at your ideal weight, you just don't like the shape of your body and you want to contour the shape of your body, then liposuction is a great procedure to do that, okay? So pre-op, of course, you got to make sure that you are healthy enough for this procedure, especially to be doing it in an outpatient office-based surgery setting like the one we have here at Pure. So we are going to look at several things to make sure that you are healthy enough to then proceed with the liposuction. So one of the things that we look at is your BMI, or your body mass index, okay? And that's basically the comparison of your height to your weight. There are BMI calculators you can find easily on the internet. You can just Google BMI calculator. You can hit that, you enter your height, you enter your weight, and it'll tell you what your BMI is, okay? And for me, your BMI needs to be less than 30. Less than 30 is what your BMI needs to be in order to have liposuction, okay? There really is not that much of a lower limit. Of course, thinner people don't have fat to liposuction, but typically the low end of that would be somewhere with BMI around 19 or 20, okay? But the max BMI is gonna be 30. Age, okay, if we're doing a big liposuction case, a lipo 360, it does take a toll on the body. It's not easy, you know, necessarily easy to recover from this, okay? And as you may know, it's not the same thing doing a marathon when you're 30 as it is doing a marathon when you're 80. Now, of course, I understand everything is relative. There are super fit people that are older, but we do have to take this into consideration. So the age limit for me is 50. So 50 years old is the age limit for liposuction, okay? Now this may vary from surgeon to surgeon, both the BMI and the age limit. All right, of course, prior to that, we gotta make sure we get all your labs, we're gonna get your EKG, and we're gonna get your medical clearance from your primary care doctor, okay? In terms of the labs, we get several of them, you know, too many to like go over here, but of course you'll get a list from our pre-op department, which is very, very important. But one of the most important ones that we do check is your hemo level, your hemoglobin level. All right, that hemoglobin level needs to be 11 or higher. Ideally 12 or higher, but definitely we do not accept anyone that has a hemoglobin level that's less than 11. So we often get the question, you know, there are some people that have some blood disorders, such as the most common one that we get asked about is thalassemia. Now, if you have thalassemia, but it's a mild one and your hemoglobin level can be 11 or higher, then typically it's okay to move forward. However, for some people with thalassemia, it's very, very tough to get that hemo level 11 or higher. They just can't physically do it because of the of the genetic issues with their blood, and therefore, unfortunately, you wouldn't be a candidate at that time, okay? And that is even though we use the cell saver, which is something I'll discuss here in a second, okay? All right, but that's really step one. So are you the right candidate? Are you healthy enough for surgery? And we're gonna check all these things to make sure that you're able to get the liposuction, okay? All right, a lot of this, because a lot of our patients are from out of town, we can do virtually. So you can send in your virtual, the easiest way is to send in your virtual consultation form. So you go to our website, and there's a little button there that says virtual consultation. You hit that button, you can put in all the information and your photos, and that can start the evaluation, okay? So a lot of this is done beforehand, and then once you got your date set up, you're gonna come in the day before surgery, all right? Now, what do we do the day before surgery? Of course, we're gonna meet, we're gonna talk, I'm gonna do your physical exam, I'm gonna evaluate everything, but most importantly, we're gonna go over your goals. What are your goals for this procedure? What is it that, exactly that you want to achieve, okay? And that's very, very important because I have to make sure that your goals are realistic, right? And that's the whole part of this conversation. So I want to make sure that, the goals are realistic. And so, if for whatever reason they don't seem to be, like if you show me, wish pick or a vision board and they don't seem to be realistic, then of course it is my job to kind of let you know what I can and what I can't do, okay? And then we have to talk about what is the type of liposuction that you want to undergo, because there are, actually three probably important types, right? Before there used to be just like plain liposuction, and nobody really does that anymore because that wasn't like just bringing out shape, that was just reducing fat. Now, of course, we're a lot more, it's a lot more nuanced than that, okay? We're a lot, we do what we call liposculpture. So pretty much your baseline liposuction is liposculpture. We're doing body contouring, we're sculpting the body to one that's gonna make you happier and more aesthetically pleasing, okay? And then from there, if you want to just kind of bring out the abs, and that's the only thing you want to bring out, and that's called ab etching. And then if you want to really kind of bring out, the muscle definition, the obliques, the abs, you really get into more and more definition. That's what we call a high def or high definition liposuction there. All right. Now, not everyone qualifies for HD lipo. Not everyone's going to qualify for that. That's going to be on the lower BMI range. Typically a BMI of 24 or less. That's one key factor. The second key factor for HD lipo is skin quality. You have to have good, tight skin, okay, in order to be able to do this. If you have loose skin because of prior weight loss or multiple pregnancies, the HD lipo is not going to work. First, you should get your tummy tuck. Get your tummy tuck first, and then come back for your HD lipo. Make the skin tight, and then you can do your HD lipo. But if you have loose skin, whether it's genetics, weight loss, pregnancy, for whatever reason, HD lipo is not going to work, okay? And yes, if you want to do, if you have loose skin, I always recommend doing the tummy tuck first, and then coming back 3 to 4 months later to do your lipo 360 or sometimes your BBL. Okay. All right. So that's all important, and you got to make sure that when you come in here and you're getting ready for surgery, that you have all the supplies that you need. Okay, and that you have someone that's going to be taking care of you. Okay, you definitely need an adult 18 years or older who's responsible, who's going to be taking care of you for the first 48 to 72 hours, ideally the first 5 days, who's going to be helping you. But they can't leave your side in the first 48 hours. Okay, they have to be by your side. You need an adult by your side for the first 48 hours at all times. You cannot be left alone during that time. Very, very important, okay? Supplies, remember, the first 24 hours after the surgery, it gets really, really messy. You're gonna have a ton of drainage, fluid's gonna be leaking from everywhere. So you gotta make sure that you have the necessary pads or coverings or chuck pads to put over all the areas you're gonna be, over the bed, the couch, etc., to protect them from all that drainage, okay? That's really, really important, okay? There are, other supplies. Well, you're going to have to stay hydrated, so you have to make sure you have plenty of water, some Gatorade or some Pedialyte, maybe some pineapple juice as well, okay? And that's also going to be very, very important. So we are going to be giving you like a list of supplies that are necessary, and then that way, before you come in, you got to make sure you have everything on that list so that you're ready for the after surgery for your post-op period. Okay, so post-op. Surgery day, I didn't put that in here, but surgery day, I do them all under general anesthesia, okay? There are some surgeons that do under local. I don't do it under local. I think it's too much surgery to do under local. I think the patients are uncomfortable. They don't really tolerate it well. And the only way to do it under local is if you use lidocaine. And the problem with lidocaine is that if you put in too much, you can get something that's dangerous that's called lidocaine toxicity. All right, and that can lead to cardiac or neurological events, which can be very, very serious. All right, so when you do it under general anesthesia, no lidocaine is needed. Therefore, you completely eliminate that risk. Okay, in general anesthesia, when it's done by the right providers, and we have some great CRNAs here at Pure, is very, very safe. Okay, so it's going to be under general anesthesia. If we're doing just a straight up lipo 360 and your BMI is kind of mid-range, it'll take about an hour and a half or so. So an hour and a half of surgery time, and then you're going to be in a recovery room for at least another hour before then you're picked up. But it is going to be outpatient surgery. You're going to go home the same day. All right. Also, I forgot to mention in pre-op, we're going to be giving you all your medications, and you're going to have an antibiotic, an anti-nausea medication, as well as your pain medication, which typically we give Percocet. And you get that the day before, so you get those all filled out and you have them all ready to go for the day after surgery. Okay. All right, so adult caregiver, we talked about that. You need an adult with you for 48 hours. They can't leave your side. Very, very important, okay? And it also cannot be your teenage son or daughter. That's not good enough. You can't have your 16-year-old daughter taking care of you. That's not going to cut it. She can be super responsible, I get it, but it's not going to do, okay? Drainage, especially the first 24 hours, it's just a mess. It's a mess, okay? Don't worry about that. Don't get scared. It happens to all the patients. You have a ton of drainage. It can look a little red sometimes, all right? But it's just part of the process. Why is that? Because right before we do the lipo, we instill about 4 liters of what we call tumescent fluid. The tumescent fluid helps shrink the blood vessels so there's less blood loss overall. But blood loss, of course, is never going to be zero. So in the same way, you have a big, tall glass of water, and you put in 2 drops of red dye. What happens? The whole glass turns red. It's a very similar process that's happening here. Put in 4 liters of fluid. There are some drops of blood in there. It's going to look red when it comes out as drainage. You're not bleeding out. You're not hemorrhaging. It's part of the process. Okay? All right. Hydration, incredibly important. 1 gallon of fluid per day. Mostly water, some Gatorade, some pineapple juice. 1 gallon per day. Okay? Walking. Incredibly important. Why? Because we want to minimize risk of blood clots. Blood clots can usually start in the back of the leg. From there, they can travel to the lungs and cause what's called a pulmonary embolism, which is incredibly serious and can be fatal. Okay? This is on the patient. I can't walk for you. All right? Incredibly important. The patient needs to walk at least 10 minutes every hour, okay, while awake. So that we can minimize the risk of blood clots, okay? The other thing that we can provide is a device that goes along the legs. Here, the one that we use here is called the VenaPro. It's actually mandatory for anyone that has a flight over 3 hours, but I do highly recommend it for everyone, to be honest with you, because it protects you even more. It keeps the circulation in the legs moving. It keeps that, to prevent any potential blood clots, and you can use it at night while you're sleeping. Right? And that way you don't have to get up, throughout the night. It's going to make your night a lot more comfortable. It has an 8-hour battery life. You can sleep your 8 hours, get up, start doing your walking. It's not a substitute for walking. It's an addition to walking, okay? So you want to do your walking, and if you want, you can use the sequential compression device, the one that we have here. It's called the VenaPro. All right? Compression, of course, is very, very important. Here we call it the faja. I think it's called faja now everywhere, and that's a Spanish word. But yeah, the faja, there's going to be different stages to the faja. You're going to have your stage 1, which is what you start, and that's what we're going to put you in as you're waking up from anesthesia. Now your stage 1 faja, it's not going to be the super, super tight faja. You don't want that initially, okay? You want a faja that's nice and snug, but you don't want it super tight. If you put on a faja that's too tight too soon, that is counterproductive. It can lead to the skin not getting enough blood supply or oxygen and skin dying, which then some people call faja burn or lipo burn. Or it can lead to more scar tissue forming, fibrosis, which then leads to a lumpy, bumpy appearance. Okay? So do not use a faja that's too tight too soon. You want to be in your stage 1 faja for at least a week. Make sure that the skin is doing okay, that you're recovering well, and then perhaps after about a week or sometimes longer depending on the patient, then you can switch to your stage 2 faja, which is going to be more compression. As the body starts to heal, the swelling starts to go down. It's even possible you may need a third faja down the line, okay? But in terms of your compression, in the first 6 weeks, you're going to be using that faja night and day. Night and day. After 6 weeks, you're going to scale down to 12 hours a day, and then you're going to use it for 12 hours a day until you get to about 3 to 4 months post-op. Okay? All right. And then last but not least, your massage. Massage for liposuction is very, very important. And these are not the same massages that you get at a place like Massage Envy or your Swedish type of massage. Okay? They're totally, totally different. This has to be done by a trained lymphatic post-op lipo or post-lipo massage professional. Okay? And you're going to need at least 20 massages, at least 20 in total, to optimize your results. The first 7 massages are going to be daily. The next 7 are going to be about 2 a week. And the final 7 are going to be weekly. And that's going to equal to about 20 to 21 massages. Right? 7 times 3 is 21. All right, so you're going to be getting some massages while you're here in town. And you're going to be getting some massages at home. Also, the way that the massages are done, the duration of the massage, and the goal of the massage also differs as you move along. Initially, the massages are meant to remove some of that excess fluid, that same tumescent fluid that you have there, okay? So the massage, but you just had surgery, so it's gonna be tender. So those massages tend to be shorter. They tend to be about 30-minute massages, all right? And they're gonna be removing a ton of fluid. And those are like the first 5 to 7. After that, then we start going into more contouring massages. We're trying to get the skin to be nice and smooth. We're trying to prevent fibrosis, and we're starting to contour the body. Those massages can be a bit longer. They can be 45 minutes to an hour, okay? And then lastly, once you get into those weekly massages, it's a weekly maintenance massage to deal with some of the residual inflammation that you're gonna have. Because like I said before, it takes 3 to 4 months minimum to have all the inflammation go away. Sometimes some patients can take a little longer. It could take 6 months or longer sometimes, okay? But massages are key, extremely important to do your massages, okay? All right, so recovery, all right, so you've had your surgery, you're starting to recover. You know, the first 24 hours, like we said, a ton of drainage. You're not gonna feel super hungry, but make sure you stay hydrated. All right, you may feel like a little woozy because of the general anesthesia and the big surgery and everything like that. So be very, very, very careful when you try to get up, okay? Don't just kind of bounce up and then try to walk right away, because you can then have the blood rush down. You can have what's called a vasovagal response, and then your blood pressure drops and then you faint. So you have to be careful with that, okay? Especially the first 24 hours, you want to be moving very, very slowly. You go from laying, you go to sitting, wait there for a couple minutes, see how you feel. Stand up, wait there a couple minutes, see how you're doing, then walk, okay? So take it easy, especially in the first 24 hours. Typically after the first 24 hours, then you're doing okay and you don't have to go so slow, all right? But that's very, very important. You're gonna be seeing us post-op day 1, either in person or virtually, and then you're going to come back on post-op day 5. I do use a drain in the lower belly area, so on post-op day 5, we're going to remove your drain, and we're going to remove all your stitches, okay? And by then, you've had 5 massages as well, because at that point, they're daily, okay? And then your faja, you're going to be wearing it basically night and day until you get to 6 weeks. At 6 weeks, in the first 6 weeks, no heavy lifting, no strenuous activity, and you can't submerge the body underwater. So there's no swimming, no bathtub, no jacuzzi. After 6 weeks, then the faja scales down to 12 hours a day. You can start, then life starts getting back to normal, okay? You can start being active, you can start going to the gym, you can do swimming and all this stuff. You haven't fully healed yet, but life goes back to normal, okay? but you're still using that faja 12 hours a day to at least 3 to 4 months out. 3 to 4 months, then everything should be mostly settled, probably not 100%, but maybe a good 85 to 90%, okay? And then life should be, pretty normal around that point in time. So what we call that whole span of time is what we like to call the physical and emotional roller coaster, all right? And I've done like whole talks on this topic, so I can't get into a lot of detail right now. But basically it means you're gonna have a lot of ups and downs in those first 3 months, okay? And for a lot of people, they start off pretty excited because like, yay, I had my surgery, finally, my day has come. I had my surgery, I'm alive. I'm coming back to my kids and my family because we did everything safely for you. And then, at 6 weeks or so, you're starting to hit a low point. You're just sick of the faja, you're sick of the massages, you're sick of not being able to do it, a lot of heavy lifting or going to the gym and stuff like that. But you're still not fully healed. Your waist hasn't shrunk down as much as you wanted and things of that nature. So it's typically a low point somewhere around 6 weeks. And then you start to feel better. You have the freedom to do more stuff. The waist continues to shrink. All the inflammation continues to go away, and then you're feeling like super hyped around 3 months, and that's when you're starting on new clothes and looking fabulous. All right, so that's the physical and emotional roller coaster there. All right, so that pretty much covers a lot of the liposuction, but of course we've talked about the good, but we haven't talked about the bad or the ugly, right? So these are the complications. Okay, so we do everything here to be as safe as possible, and we've done several talks on our safety measures. But at the end of the day, medicine is medicine, surgery is surgery, and it is impossible to have a 0% complication rate. Okay? If you want to have a 0% complication rate, then don't do surgery. That's the only way. That's the only way. All right? But we try to minimize the complication rate as much as possible, and our complication rates here are much lower than the national average, which is great because we do a lot of extra steps for your safety. Okay, but having said that, complications can and do happen, and so these are the ones that we worry about after liposuction. Okay, what is the most common complication? The most common one is called a seroma. Fortunately, it's the most common, but also the most minor. And what is that? It's just a little bit of accumulation of fluid that didn't come out with the massage, or that your body wasn't able to resorb. And typically the way to deal with that is that we have to put a little needle into the area, we aspirate the fluid, we put on some more compression, and then you're done. Okay? But that's why the massages are so important. If you have adequate massage, then the rates of seroma are much less. If you have adequate compression, the rates of seroma are much less. Okay? And that way you don't have to get poked. Okay? All right, next one I have here is infection. Unfortunately, infection rates, again, it can never be 0, but we give antibiotics during surgery and after surgery to try to minimize that risk. The infection rate for liposuction alone is about 1 or 2%, so very low, but it's not 0. What do you see if you have an infection with liposuction? Typically you see like some redness of the skin, maybe some warmth, maybe a little burning sensation. That's typically the first sign, even before any fevers or anything like that. Of course, fever can happen later on, but you want to catch it quickly so you can be started on more antibiotics, and that way we can deal with the infection. A lot of times you can treat it with oral antibiotics. Sometimes we need to have you go to the hospital and get IV antibiotics, but that's pretty rare. Okay? All right, lipo burn. So it's not a real burn. I've done a whole talk on lipo burns, and if you're curious about that, you should go to our YouTube channel. We have all our talks there, and there's going to be one that's dedicated specifically to lipo burn. But the bottom line is, it's not really a burn. It's not a thermal burn like you think of it because things got too hot. It's because the area of the skin there has lost its blood supply. Okay. Now there can be several reasons for these quote-unquote burns. Some of them could be surgeon related. So the surgeon is overly aggressive, they remove too much fat, and they left the skin too thin. That can be an issue. Okay, and that's why I always like to leave at least 1 centimeter of fat beneath the skin there to minimize any risk of a lipo burn. The other one I mentioned before, if you put a faja that's too tight, that's going to cause less blood supply to particular areas of the skin, and that's going to lead to a quote-unquote burn, which is basically skin dying. Okay? So you got to be very careful with that as well. If we catch it early, the key is to catch it early. If you catch it early, we take you out of the faja, we put a special cream on there called Nitrobid, and a special pill called pentoxifylline, and most of the time that's going to take care of the issue and it resolves, okay? But there are times where unfortunately that skin just did not survive. Eventually that skin will slough off, it'll leave a scar, and sometimes we have to come back and do a scar revision, 6 months or later down the line, okay? All right, this is a dreaded complication which you never want to see. Perforation, okay? That is pretty much strictly on the surgeon. A perforation is basically where the cannula went where it wasn't supposed to go and went inside the belly and it perforated the organs. Okay, that's very, very bad. That's why you want to go to a place where you have a surgeon that has a lot of experience with this procedure so they know what they're doing. Okay, this is typically a surgeon who lost their place, they don't know where they are, the cannula went too deep and they perforated an organ. You can perforate a lung, you can perforate intestines, you can perforate the liver. I've even seen I've seen or read about perforation of the heart. I mean, so you definitely want to make sure that you're going to the right person to avoid this very, very dreaded complication there. Okay, the other thing though, it's not really on the patient, but what you guys should know is that if you have a hernia, whether it's a belly button hernia, a ventral hernia, any sort of hernia in the belly area, you should get that fixed first before your liposuction. Okay, because if you have a hernia and you do lipo and the intestine kind of pops out that hernia without anybody knowing, and then you're doing lipo, that intestine can get hurt, and that's going to be very, very bad. All right, so keep that in mind. If you have a hernia, try to get it fixed before you do your liposuction. Okay, key point there. All right, next, of course, we talked about blood clots. We talked about how important walking is and using the sequential compression device as well. Bleeding is always a possibility with any surgery. That's why their hemo level needs to be at least 11, preferably 12 or higher. We do use a cell saver, which is a machine that takes some of the blood that comes out with a lipoaspirate. We run it through the machine and goes into a bag, and we give it back to use an auto transfusion to minimize blood loss during the procedure. But even with the cell saver, sometimes the blood level can get lower, and if it gets to about 7 or below, then that's going to require a blood transfusion. Okay, so in rare cases it can go that low. I would say it can happen once or twice a year, maybe less than 1%. But those cases, then you are going to need to go to the ER to get a blood transfusion. Okay. All right, and then the other one that's somewhat common but is not completely understood is unevenness. A lot of times when people see unevenness from liposuction, they immediately assume that it's uneven lipo and that there's fat deposits left behind. And actually that's a wrong assumption, because the most common reason, the number one reason for unevenness is loose skin laxity. All right? So if you have skin that is loose because of weight loss or pregnancy or even just genetics, there are people where their skin is just not very, very tight. And you do liposuction and all of a sudden you remove all this fat, that skin can sometimes not retract well and become even more loose. And then loose skin tends to retract in a way that it's kind of lumpy, bumpy, uneven, and it can cause also a hooding over the belly button. Okay? A lot of times you see that, and the most common complaint is like, oh, you forgot to lipo the belly button. Actually, that's not what's happening. What's happening is that the skin is loose, the belly button is a fixed point, and the skin is kind of hanging over it, creating this donut-like appearance, and we call that in technical terms umbilical hooding, and so it creates that donut-like appearance, and that's due to skin laxity or loose skin. Why is that so important? Because the way to fix that is not with further lipo. You do more lipo, the problem's going to get worse. It's not going to get better because you're not addressing the issue. The issue is not fat, the issue is loose skin. So you got to fix it with either something like Body Tight if it's mild, or a mini tummy tuck or a tummy tuck. Those are the ways to fix loose skin. Okay. Another reason for probably the second, number 2 reason for unevenness is fibrosis. That's when you have that scar tissue underneath that creates a little bit of a lumpy, bumpy appearance, and that's why we talked about so much about massage and compression, because that is just as important to surgery itself to minimize the risk of fibrosis. The surgeon needs to leave a centimeter of fat underneath there. That minimizes the risk, and then you got to do your massage and your compression to minimize that risk of fibrosis as well. If you catch it early, a lot of times the massage therapists can do things to make it better. They can use other modalities like carboxytherapy or ultrasound or radio frequency or wood therapy is one more to deal with that fibrosis and make it better. Now, so if it's been a year and it's still there, sometimes we have to go back and do another liposuction procedure to even out the fibrosis. And then lastly, in some instances, there can be some excess fat in certain areas. Okay? Woo! That was a lot of talking. All right. Okay. So I know. So it's a very, very comprehensive view, and I'm happy to take some questions.
How long after a breast augmentation can I get a BBL?
Right. So 3 months would be the soonest. So you get your breast augmentation. We got to make sure that those implants have settled and that everything's fully healed before you start laying on the implant after your BBL. So 3 to 4 months after.
If I had Whipple surgery, can I still get surgery to reduce tummy fat and BBL?
Yeah, so okay, if you had a Whipple procedure, I'm assuming you may have some scarring and things like that. But you have to, so the key thing is to make sure there's no hernias, right? A lot of times you have a prior surgery, sometimes there's a hernia. So anyway, get that checked out, make sure there's no hernias, and if there are no hernias, then you can have your liposuction and your fat transfer procedure.
Okay, did you see patients with lipedema disease for lipo on the thigh?
To a certain extent, yes. It's not like my specialty, right? So someone who has like a very severe case of lymphedema, this is not kind of basically the place to treat it. Now you have more of a mild case and just causing some like contour abnormalities, and yes, because a lot of times we can treat that with liposuction. So I'm gonna take that on a case-by-case basis. I would recommend that you send in your virtual consultation so I can make an evaluation and determine whether I think I can make that better for you.
Could I use a blood bank of my own blood if I'm having surgery with you in case of an emergency?
So theoretically, yes. That's something though that we would have to really organize and kind of see where the blood bank is. Of course, we do all our surgeries here down in Miami, so that would have to be available down here. So just basically, it would be an issue regarding logistics. But technically, if we can work out the logistics, then it would be okay.
Okay. ¿Cuánto tiempo está en español?
Okay.
Vamos a aprender español. ¿Cuánto tiempo se debe estar en cama de reposo luego de un lipo BBL?
So, esta pregunta para el español dicen muchos de estar en cama. Uno no debería estar en cama. O sea, que lo que estaba hablando aquí sobre que hay que caminar es muy, muy importante. O sea, nunca va a estar ahí tirado en la cama por horas y horas y horas. Es muy importante caminar. Hay que caminar por lo menos un mínimo de 10 minutos cada hora. De noche quizás puedes dormir unas 5 horas seguidas, pero después te vas a despertar y vas a caminar 10 minutos cada hora. Y eso es muy, muy importante para prevenir coágulos.
Is it true that fat doesn't stay permanently when transferred into the hip dips?
So not completely true. So what is true is that it is a bit tougher for the fat to survive in that area because it has less blood supply than the buttock itself, or buttock proper, if you will. But you can definitely transfer fat to the area. You can definitely fill out the area and create, and it can eventually, whatever fat eventually settles will last for a lifetime. So whereas what we expect to lose in the buttock is maybe about 30%, in the hip area maybe we lose a bit more, somewhere between 30 and 50%, but we're not going to lose 100%. So we're actually really, really good at filling out hip dips, especially here at Pure. So I definitely recommend that. In fact, that's the only way to deal with a hip dip. You're never gonna, if you work out, you're actually gonna make the hip dip worse. Okay, so working out, there's no way to work out a hip dip. There's no muscle there, right? Working out is to build muscle. There's no muscle in that area. Okay, it's called a trochanteric depression, and it's a depression because there's nothing there. There's no muscle, you can't work it out. So what you need is to fill it with volume, and the best volume to use is your own fat.
Okay, just curious. Do you accept type 1 or insulin-dependent diabetics?
Yeah, we certainly do. So we just want to make sure that you're controlled, right? And also that your endocrine doctor kind of gives us a regimen of how to deal with your blood sugars during surgery. A lot of times they'll provide like a sliding scale, right? And then we have to have, if you have the monitors, we have to kind of have access to that so that we know what your sugars are doing during surgery. Because if they're, sometimes if they're too low, we got to give you a little dextrose. If they're too high, we can give you a little insulin. But anyway, bottom line is if you're controlled and we have the okay from your endocrine doctor, then yes, we can proceed.
Okay. When can we pass the threshold to not losing any more fat in butt and hips? Currently, 3 weeks post-op.
Yeah, so you're still a little bit on the losing side, right? So I typically say it's going to take at least 6 weeks. So at 6 weeks, you've probably lost whatever it is, whatever amount of fat you're going to lose. That's why for my patients at 6 weeks, you can start sitting normally on the buttock as you normally would. But also keep in mind that at 6 weeks, it's going to be a low point. It's going to be at this low point here in terms of the volume of the buttocks as well. Because after that, you're going to get into what we call the fluff phase. So those fat cells that have survived are then going to plump up, and they're going to fluff out, and you're going to get into that fluff phase, and you're going to see that at around 3-4 months post-op.
Doc, how much fat do you typically transfer to each side of hips?
That's going to depend on the patient. It can vary quite a bit. It can be anywhere from 500 cc's to 1,000 to whatever. There's two things that there are two caveats. Again, one is what is the patient looking for, right? Nowadays, nobody really wants, we go for like what we call an enhanced natural look, or I should say a look in where the hips flow with the rest of the body. You don't want to have these hips there that are way too wide and that the thighs and the rest of the body and the frame can't support, right? So it depends on what the patient wants, on the patient's frame, and number three, very important, it depends on the ability of the skin in the hip area to expand, right? Because I can expand the skin to a certain point, but eventually it's going to get really tight. Okay, and once I get to that point where it's super tight, I physically can't expand it anymore, and I physically can't, even if I try to push it in, I can't push any more fat into that area.
If a breast lift is done without implants, would fluctuation in weight make the breast sag again?
If a breast lift is done without implants and you have fluctuations in weight, yes, it could very possibly make them sag again. So fluctuations in weight, another pregnancy, all these things can alter the shape of the breast. So it is a possibility.
Could previous abdominal surgeries like appendix removal cause scar tissue, fibrosis? Could they become more visible after liposuction?
Not necessarily. So scar tissue, say you have an appendix scar or a scar from something else. Actually, sometimes we can try to lift up that scar a bit during the liposuction, and even though we can never get rid of a scar, we may make the indentation a little bit less. Also, if you're removing some fat around that scar, it can make things a little bit smoother for you, okay? So sometimes with liposuction, we can make that area look better, okay? It's never gonna be like you never had anything, like any scars there, but it can be improved.
Okay. Can you sit like normal after 6 weeks, or are there still certain restrictions? For example, not more than a few hours, or not from a side, or not sleep in certain way?
Right, so after 6 weeks, you're okay to start sitting normally, you're okay to start sleeping on your back, sleeping on your sides. Everything is, you're good to go. Now, it is going to feel a little bit weird initially, so you may not want to just sit there for hours and hours on end. You're going to feel a little odd, you're probably going to want to get up, you're going to walk around, and you can kind of ease yourself into it, but you are clear to really kind of start sitting and sleeping in any position that you want.
Okay, can you explain if it's risky to have a BBL if I have varicose veins? I have one in my leg.
Okay. So again, it depends a little bit on how bad the varicose veins are. So if you have like those little kind of smaller spider veins, that's typically not a problem. So if you have like small varicosities, that's not an issue. Now, if you have very, very large and competent veins, okay, that and the leg has these, like very visible large veins, and there's a, and you go into like swelling and stuff like that, then yeah, that may be an issue, because that means that the blood flow in the lower extremity is not as robust as we would like. And like we mentioned before, blood flow can lead to clotting, which can then lead to a deep vein thrombosis or pulmonary embolus, which can be an issue. Okay, so if you have very mild varicosities or spider veins, that's typically not an issue, but if it's more severe, then it could be a problem.
Why do you recommend doing the tummy tuck and lipo as two separate surgeries or stages?
Yes, great question. So there's a few reasons, but one of the reasons you should know is that here in Florida, when you're doing surgery in the office-based surgery setting, like the one we have here at Pure, we have limits that are given to us by the Florida Department of Health. And this limit is given, of course, to all surgeons in Florida. There are no exceptions. Okay, so the limit is that you can only remove 4 liters of fat. That is the max that you can remove if you're only doing liposuction. But if you combine it with a tummy tuck, then we're restricted to only 1 liter of fat, which is not a lot. That's typically what we get just in the flanks and the waist, is what we combine with a liposuction. So with a tummy tuck. So when we do a tummy tuck, we'll do lipo to the flanks and waist. We'll typically reach that 1 liter limit, and then we're done. So if you want really like a more defined contouring to your body, then we have to kind of separate out the surgeries. I always recommend doing the tummy tuck first. So come in, do the tummy tuck, tighten up the skin, tighten up the muscles, the muscle separation and everything else, and then come back 3 to 4 months later and do your lipo 360 plus minus, fat transfer plus minus BBL. All right. Okay, everybody. So we went into a little extra time, overtime here today. But I know it's a long topic, but I said it was going to be comprehensive. All you need to know about liposuction, okay? Or at least getting you 95% there. All right. So I really enjoyed the talk. Remember, we have these Hump Days, Hump Day Live every Wednesday. We're going to go over several topics here. We got 2 more, right? Yeah, 2 more left this year. 2 more for 2022. And then we'll be done until 2023. But we'll be here next week, so I look forward to seeing all you guys next Wednesday on Hump Day with Dr. Alex Earl. Take care, everyone. Ciao.